This video explains our one-day cataract surgery. We will explain in detail about preparation, precautions during the surgery, and how to spend your time after the surgery. First, we will explain the precautions to take before and after the surgery, and the details of the surgery according to the pamphlet. First, we shall describe pre-operative preparations. Preparation at home. Eye drops will be applied from 3 days prior to surgery until noon the day of the surgery. Please check the patient surgery calendar provided at the time of your appointment for the start date of the eye drops. Before surgery, antibiotic eye drops will be prescribed. Apply eye drops 4 times a day: morning, noon, evening, and before bedtime. If you are using other eye drops, wait at least 5 minutes before using them. This section describes the process on the day of surgery. On the day of surgery, patients may arrive either at 2 p.m. or 3:30 p.m. The maximum stay is approximately 2 hours and 30 minutes. Your arrival time depends on the order of operations and will be informed by the call you will receive at least 2 days before the operation. On the day of the surgery, please bring the surgery fee, your consultation ticket, and insurance card. You can pay by cash or credit card. We will also provide you with information on the supplies you will need after the surgery. All items can be purchased at the hospital. To prepare for surgery, you have to keep applying the eye drops until noon the day of the surgery. Please take your usual medications and meals as usual. The operation takes 5 to 10 minutes for each eye. Please do not touch your face during the surgery, and speak up if you feel uncomfortable. Please be assured that we will remind you about caution every time. This section provides information on life after surgery. Right after the surgery, there are some restrictions and precautions. To check the condition of the eyes after surgery, you will have a medical examination the day after surgery, the 3rd day after surgery, and around 1 week after surgery. After the surgery, you will be prescribed 3 types of eye drops, which you should start applying in the evening when you return home. If you have original prescription eye drops, you need to wait at least 5 minutes after applying the eye drops which we prescribed, before using your original eye drops. The eyes need to be protected immediately after surgery, until the morning of the 3rd day after surgery. You will wear protective glasses while awake, and a plastic eye patch when sleeping at night. These necessities can be purchased in our clinic on the day of surgery. After surgery, there are restrictions on washing your face and bathing until the morning of the 3rd post-operative day. From the day after the surgery, you can take a shower only from the neck down. Cotton is available at the hospital for wiping the eye area, while there are restrictions on washing the face. Driving a car or motorcycle is usually prohibited for 1 week. But always check with your doctor to see if you can resume driving. The next section will provide an explanation of cataract surgery. A cataract is a disease in which the lens, which is the pathway for light, becomes cloudy. In order to resolve vision problems caused by cataracts, the clouded lens must be surgically removed. In surgery, the cloudy lens is replaced with an artificial intraocular lens. First, the area around the eye and the eye itself are disinfected and anesthetized with eye drops. Next, make a 2 mm incision on the outer side of the conjunctiva and sclera. A hole is made in the surface of the lens. and a machine is used to aspirate the fogged area. A clean, unclouded lens bag remains, and an intraocular lens is inserted here. Finally, check that the wound is closed and finish. It takes approximately 5 to 10 minutes to complete the surgery. Subconjunctival hemorrhage may be seen after surgery, but it will disappear in 1 to 2 weeks. Regarding the surgical incision method, there are 2 methods for making the incision in cataract surgery: sclerocorneal incision and corneal incision. The advantages of sclerocorneal incision include minimal postoperative astigmatism, a strong incision site, and high effectiveness in preventing infection. The disadvantages include redness of the white part of the eye after surgery, and a possible sensation of a foreign body for several weeks postoperatively. The advantage of corneal incision is that the whites of the eyes are less likely to become red after surgery. Disadvantages include increased corneal sensitivity due to the procedure, reduced strength of the incision site, and a higher risk of infection. Our clinic performs sclerocorneal incision, which offers more stable surgical outcomes. Describes complications of surgery. After cataract. This complication is a partial clouding of the pouch after surgery. The probability is about 20%. Cloudiness can cause difficulty seeing and hazy vision, but can be treated with lasers. Lens capsule and ciliary zonule fragility. The lens bag and the string-like tissue suspending the bag are weakened. If there are weak areas, reinforcement materials may be used, or the method of fixing the intraocular lens may be changed. Postoperative infection and endophthalmitis. It refers to infection from a wound. Untreated, severe cases may result in visual impairment. Preventing infection can be done with eye drops, before and after surgery, and eye protection. We will explain the examinations necessary for the surgery. Various examinations are performed to determine the intraocular lens, based on the results of the examinations, and after carefully asking about the patient's wishes. We will propose the type and power of the intraocular lens. Blood tests will be performed to confirm that there are no problems with the surgery. It will be performed only when the doctor determines that it is necessary. Postoperative medical precautions. Immediately after surgery, you may experience temporary difficulty seeing for the next few days, due to inflammation, but most will improve within a few days after surgery. We will provide an individual explanation regarding the details of each patient's case. If you have any questions or concerns, please don't hesitate, and let us know.